Welcome to the Basic Obstetric Ultrasound Training course for healthcare providers. Ultrasound plays an important role in identifying pregnancy-related conditions that put the mother or fetus at risk during delivery. In most low-income countries, there is a shortage of people experienced in performing pregnancy ultrasound. This course was created to train healthcare workers to perform basic pregnancy ultrasound in parts of the world where formal training is not available. The videos, as well as other educational materials, available at tinyurl.com/UW-ultrasound, are designed to be used in a 2-week ultrasound course. The hands-on sessions in the trainer's guide are an essential component of this course and must be supervised by an experienced ultrasound practitioner. This is not a comprehensive pregnancy ultrasound course and does not result in an official certification or diploma. After you finish the course and pass the written and practical tests, we strongly recommend you have at least 40 hours of scanning experience with clinical mentoring before you undertake unsupervised scanning. My name is Dr. Christina Adams-Waldorf, and I will be narrating this 9th video in our pregnancy ultrasound series. This video will teach how to determine the age of a fetus in the first trimester. Please visit our website for access to all of our video and training materials. There are 3 main skills you will learn in this lesson. You will learn how to measure the mean sac diameter and crown rump length to estimate fetal age. You will also learn how to choose the best ultrasound images to determine fetal age. This last skill refers to assessing both the position of the fetus and the quality of the image itself, so you will need to use your previous knowledge of echogenicity, gain settings, and depth that we covered earlier. In the first trimester, the size of the fetus does not vary as much as it does in the second or third trimester. Therefore, fetal age will be more accurate if you measure it in the first trimester using the first sonogram that can find a yolk sac or fetal pole with a heartbeat. An ultrasound without a yolk sac or fetal pole and heartbeat is too early. Once you determine the due date by an early pregnancy ultrasound, do not change it based on a later ultrasound. These are sagittal and transverse images of the uterus showing a collection of fluid. Here we have labeled the gestational sac, which is the fluid sac that contains the fetus. In a very early pregnancy, you may see a gestational sac without any other structures. This sagittal image of the uterus also shows a small fluid collection. This could be a gestational sac, but sometimes fluid from other causes can collect in the uterus and look like a gestational sac on an ultrasound. This fluid could be from a miscarriage, bleeding, infection, or a pseudosac of an ectopic pregnancy, which looks similar to a gestational sac. This is a sagittal scan through the uterus in early pregnancy. The bladder is above the uterus. Here you can clearly see a gestational sac inside the uterus. The small circle in the gestational sac is the yolk sac. A yolk sac can first be seen before the fetus becomes visible at about 6 weeks gestational age. The yolk sac provides nutrients to the developing fetus. The way you estimate the age of a fetus depends on the stage of pregnancy, or in other words, what you can see on the ultrasound. The first sign we can usually see of a possible pregnancy is a gestational sac in the uterus. A yolk sac, however, is the first reliable sign of an intrauterine pregnancy. So if you can't see a clear yolk sac, it is too early for fetal dating. Ask the patient to return in 2 weeks to confirm the pregnancy. This is another normal early pregnancy without seeing a fetus. This sagittal image shows the uterus, gestational sac, yolk sac, and fetal membrane. Please pause the video now to identify these structures within the group. Here we have outlined these structures. A thin membrane is sometimes seen early in pregnancy, but usually not later unless you see the membrane between twins. A yolk sac is a definite sign of a uterine pregnancy. If we can clearly see a yolk sac on ultrasound, we can determine the age of the fetus by measuring the gestational sac. This method uses a measurement called the mean sac diameter. If we see a yolk sac, we also know that there is an intrauterine pregnancy. We can be confident that the patient does not have an ectopic pregnancy outside of the uterus. Note that there is a rare situation in which a woman can have both an intrauterine pregnancy and an ectopic pregnancy. This is quite rare, but more common in women who have undergone in vitro fertilization to improve chances of pregnancy. To find the mean sac diameter, follow these steps. First, measure the greatest length, width, and height of the sac. Then add these numbers and divide by 3. Finally, find the number on a standard table to estimate the gestational age. Many machines will have a built-in program called an OB package. If you have the OB package, then make 3 measurements and the machine will calculate the gestational age for you. Otherwise, you must do the math yourself. It is very important to make precise measurements so the gestational age is accurate. Please pause the video now to find the gestational sac measurement chart in your participant handbooks. Please ask your trainer to show you how to find the gestational age from the mean sac diameter. If you do not have a participant handbook, please download from the website shown on the screen. This is a transverse scan or cross-section of the uterus with a gestational sac that will be used to measure the height and width of the gestational sac. The echogenic tissue around the sac is normal and is shown here. Be sure to measure only the fluid, not the echogenic tissue. If you include the echogenic tissue, the fetal age will be too old. The correct area to measure is shown by the calipers, and the measurements are shown on the lower left. Please note that we will use these numbers for a gestational age calculation in a few slides. This is a sagittal scan of the uterus that will be used to measure the length of the gestational sac. Now we have the last of the 3 measurements to calculate the mean sac diameter. Now that we have length, width, and height, we can calculate the mean sac diameter. When we add these numbers together and divide by 3, we get a mean sac diameter of 1.4 centimeters. On some machines, the length, width, and height measurements will be called D1, D2, and D3, referring to 3 different diameters. Please pause the video now to use your gestational sac measurement chart to estimate the gestational age that corresponds with this mean sac diameter. The answer is 5.6 weeks. Let us review the methods to determine fetal age. If you see a gestational sac but no yolk sac, ask the patient to return in 2 weeks for another ultrasound when she is farther along in her pregnancy. If you can see a yolk sac, measure the mean sac diameter. The last method to find fetal age can be used when you see a fetus on ultrasound. If you see a fetus with a heartbeat, the best estimation of gestational age is made by measuring the crown rump length, or CRL, which means measuring the length of the fetus from the crown of the head to the rump. The crown rump length is very accurate for determining gestational age if it is done correctly before 14 weeks and varies by 3 to 7 days from the actual age. With a very early fetus, we always measure the greatest length of the fetus, but never include the yolk sac, which is usually located right next to the fetus. Here we have labeled the fetus and the yolk sac. This is an example of a correctly measured crown rump length. It does not include the yolk sac, which is located very close to the fetus. This is an image of a very early fetus at approximately 7 weeks. If you see a fetus, look for the heartbeat. Remember that we must have a heartbeat in our ultrasound protocol for fetal dating. If you can't see the heartbeat, send the patient to your referral hospital. Notice the calipers, which appear as small white crosses that measure the crown rump length. The crown rump length is the greatest length of the fetus. This is another early fetus at about 8 weeks. It is still too early to see a fetal profile. Can you see the yolk sac in this scan? Here we show the yolk sac. The yolk sac is visible from 6 to 7 weeks. It is present until the end of the first trimester, but we often can't see it later in the first trimester. These calipers are well positioned for the longest fetal measurement for the crown rump length. In older fetuses, you can identify the face and limbs. To measure the crown rump length correctly, the fetus must be in the correct position. Usually, the mid-sagittal plane will give us the best view. First, the fetus must be lying in a neutral position. This means not bent or flexed, and not with an arched or extended back. Secondly, the fetus must be in profile, meaning you can see the face. If the fetus was turned toward or away from us, you could not see the face. Again, in early pregnancies, it is often not possible to see the face. To measure a crown rump length, we measure from the top of the head to the outer edge of the rump. Do not include the fetal limbs and yolk sac. Please pause the video now to ask your trainer to demonstrate the correct area to measure on a doll. It is best to take 3 separate crown rump length measurements. If all 3 images are good, average the values. If one is clearly better than the others, use that image alone to determine gestational age. The calculation of the gestational age will either be made by the ultrasound machine or can be done easily by looking at the crown rump length chart in your manual. Please pause the video now to find the crown rump length chart in your manual or download the participant manual from our website. In this view, notice that the fetus is in a neutral position, not flexed or extended, and in profile, meaning that you can see the face. Notice that the calipers are properly positioned on the top of the head and bottom of the rump. Please discuss the following questions in the group. Is this fetus in a neutral, extended, or flexed position? Is the fetus in profile? Are the calipers correctly positioned? Please pause the video now to discuss the answers. The answer is that in this image, the fetus is in a neutral position, in profile, with correctly positioned calipers. Here we have labeled the face. Here is another measurement of crown rump length. Please pause the video now to ask the group if the crown rump length can be accurately measured based on the fetal position, profile, and caliper placement. The answer is that the fetus is slightly flexed or bent, but is overall in an acceptable position. We can see the face, which means that the fetus is in profile. The calipers are also correctly positioned from the top of the head to the rump. Is this fetus in an ideal position for measurement of the crown rump length? This fetus is also slightly flexed or bent, but is overall in an acceptable position. The fetus is in profile because we can see the face. The calipers here are correctly positioned from the top of the head to the rump. In this image, please notice the crown rump length measurement and gestational age calculation at the bottom of the screen. This calculation was done automatically by the ultrasound machine. Most machines will have this feature, but you will still need to take the measurement of crown rump length. We can see here that a crown rump length of 4.5 centimeters corresponds with a gestational age of 11 weeks and 2 days. The computer's gestational age is only as accurate as your measurements, so measure carefully. Now consider the fetus in this image. Is this fetus in an ideal position for the measurement of crown rump length? Please pause the video to encourage responses. The answer is no. This fetus is slightly extended, meaning that it is in a straighter position than we would like. Looking at this scan, would you use crown rump length or the mean sac diameter to estimate the age of the fetus? Please pause the video now to discuss within the group. The answer is to use the crown rump length. Remember that crown rump length is more accurate than the mean sac diameter. If you see the fetus, do not use a measurement of mean sac diameter for gestational age. In this case, we should use the crown rump length to estimate gestational age. Now consider whether the fetus is in an ideal position for crown rump length measurement. Pause the video now to encourage responses. The answer is that the fetus is not in profile since you cannot make out the facial features. Try to get a better image, or wait for the fetus to change position before measuring the crown rump length. Even if the fetus is flexed, the crown rump length is always more accurate than the mean sac diameter. Please pause the video now to invite a volunteer to assess whether a crown rump length can be accurately measured using the fetal position, profile, and caliper placement in this image. The answer is that the fetal position is too extended to accurately measure the crown rump length. There is a slight profile because we can see a portion of the face. The calipers were placed correctly. Please pause the video again to invite a volunteer to assess fetal position, profile, and caliper placement. The answer is that the fetal position is not neutral and we cannot see the face. The calipers were placed correctly. Here is another example. Please pause the video again and ask another volunteer to assess fetal position, profile, and caliper placement for crown rump length measurement. The answer is that the fetal position is too flexed. The fetus is not in profile because we cannot see the face. The calipers were placed correctly. What is wrong with this image? Please pause the video to ask for reasons why the image appears poor. The answer is that the gain is too bright in the mid and deep zones and should be adjusted. We can't see the fetus well enough to accurately place calipers. The depth is also incorrect. With too much depth in this image, the fetus becomes too small to measure accurately. Set the depth to only be as deep as necessary, in this case, possibly 7 centimeters. Notice the dots on the right side of the screen that represent centimeters of depth. Let's review the key points. Gestational age is most accurate in the first trimester. Use mean sac diameter for gestational age only if you see a yolk sac. Once you can see the fetus, use crown rump length to estimate the gestational age. Measure carefully to get an accurate gestational age. Do not change the due date after the first ultrasound with a heartbeat, even if more ultrasound measurements are taken later. Questions for review. Please pause the video now to discuss these questions and answers among the group. What does the gestational sac look like on ultrasound? The answer is a small anechoic fluid collection in the uterus. Which structures must you see to confirm a normal pregnancy? The answer is either the yolk sac or the fetal pole. If you only see a gestational sac, when should the patient return for another ultrasound? The answer is that the patient should return in 2 weeks. Is fetal dating more or less accurate in the first trimester than at a later time? The answer is that fetal dating by ultrasound is most accurate in the first trimester. How do you calculate the mean sac diameter? The answer is to add the length, width, and height of the gestational sac and divide by 3. How do you measure the crown rump length? The answer is to measure from the top of the head to outer edge of the rump, and remember not to include the yolk sac. Thank you for your attention and interest in learning pregnancy ultrasound. Please pause this video now to ask your instructor any questions about this course. We thank the following individuals who played a major role in course development: Dr. Robert Nathan, Dr. William Marks, and Nicole Goldsmith, registered sonographer. Many other individuals contributed valuable time and expertise in the instructional design and materials development, including Dr. Christina Adams Waldorf, Dr. Scott Barnhart, Dr. Michael Kawuya, Susan Kingston, and Stacy Lissett. Finally, we wish to thank Dr. William Marks for the use of images from his book, Ultrasound, A Practical Approach, and Jennifer Summers and Jan Hamanishi for graphic design and illustrations. The University of Washington Department of Radiology has trained healthcare workers in pregnancy ultrasound in many parts of the world. If you have questions about this video or course, please contact Dr. Robert Nathan, Dr. William Marks, or Dr. Christina Adams Waldorf. This course was collaboratively developed by the University of Washington Department of Radiology, Obstetrics and Gynecology, and the International Training and Education Center for Health, ITEC. It was made possible through a grant from the GE Foundation. Consano also contributed funding. We are grateful for the video production sponsored by the University of Washington Institute for Simulation and Interprofessional Studies. Please visit our website at tinyurl.com/UW ultrasound to access all of our training materials. This material is copyrighted. You are permitted to copy, distribute, and post to websites. You are permitted to modify the content to adapt to specific populations and user needs on the condition that you include attribution to the University of Washington and retain any copyright notices and citations and attributions included in the original Basic Obstetric Ultrasound Training for Midwives. The material in this video is provided for information purposes only. The University of Washington Institute for Simulation and Interprofessional Studies does not take responsibility for the accuracy of the content in this video.